Okay, I've been getting a lot of emails from you all about your experiences or your questions about or with breast cancer. So I'm going to try to go through these pretty quickly so we can take advantage of the great minds that we have here on the set. And I am not included among them, I'll tell you. I'm learning everything, though, as I go along here with you all. Let me see. We have one from Maddie that says, I was diagnosed with cancer just a week ago. I am in a fog. I need to decide whether to have a mastectomy or a lumpectomy. The cancer is in its early stage, thank God. I will not need radiation treatment, again, thank God, but I feel like I need a second opinion. It seems like everything's happening so fast. What advice would you give me? Should I even get a second opinion?
I would advise her to slow down.
Slow down, because I'm going so fast.
Yeah,
okay.
Slow down.
Yeah.
This breast cancer, while we want to treat it in a timely fashion, really you do have time to talk to other people, to go get a second opinion. We find it helpful in our practice to have our patients go and talk to a plastic surgeon and also to the radiation oncologist so that they can be educated in all aspects involved with both options.
Right.
And also, you know, family history and kind of what the availability of, you know.
I can totally relate because I would be like her. I would want to get this taken care of right away. And what do I need to do right now to get it done? So you're saying she can slow down. Okay.
We think that it's okay to wait 4 to 6 weeks. Women really can make bad decisions for themselves if they decide immediately. So it's a good idea to just, take a little bit of time, talk to friends, talk to a support group.
Well, I'm glad that you mentioned that because this next one, I'm paraphrasing, it's quite a long email, and I know that you've had a chance to read it. This woman, right after giving birth, was diagnosed with stage 3 invasive ductal carcinoma. And she said she's gone through her chemo, she's recovered from the bilateral mastectomy, but her difficulty is that it separated her from bonding with her child through nursing, and that she's really finding it difficult, even with support, to have let go of that experience and not get the chance to do that again. What can we say on the emotional aspect of it?
Well, from the emotional aspect of that, I guess what sometimes you have to look at is take a step back and say, well, you may not have been able to breastfeed, and for a lot of women, that is so important in bonding, but you're still there for your child. You're still there. You still get to hold that baby in your arms. You're going to be able to take that child to all of their things, everything they want to do, their first day of school. And yeah, you didn't breastfeed them, but you can do everything else for them.
Yeah, this is a case of where you have to see a bigger picture and just understand maybe that you're going to miss that part. This one from one of our viewers is about a tram flap, and that's a very difficult procedure. Can you explain in a nutshell what a tram flap is and why it's so hard on a patient?
Well, a tram flap is called a transrectus abdominis myocutaneous flap, and it's actually, they take the abdominal fat and some of the skin, and they move it into the position of the breast, but they use the rectus abdominis muscle, which is that six-pack muscle, for the blood supply. So it disrupts the muscles on the abdominal wall, which, as she says in her email, does make you prone to forming a hernia. There's some newer techniques out. They're not available everywhere, but another flap technique is to actually called a free flap, where they actually, instead of disrupting the muscle, just move the tissue and reconnect the blood supply to a different vessel.
Wow, what she is saying, though, is having breast cancer leaves many different types of scars. It's a life-altering diagnosis from many vantage points. I have chosen to remain positive and am most grateful. I have been healthy, free of cancer since that time period, but my physical life was drastically altered as a result of the surgery and reconstruction. She says, I feel the public needs to be drastically more educated about reconstruction choices.
Right. And I think some of that has to do with the plastic surgeon educating the patients as well. When we see our patients for when they're first diagnosed with breast cancer, I always go over with them what their options are for reconstruction if they're going to choose a mastectomy. But when you sit down with the plastic surgeon, you want to make sure the plastic surgeon gives you all your choices too, because there are some doctors are more comfortable with one technique than another, but you need to make sure it's best for you, not just for them.
Sounds like we really have to be our own best advocates.
We do have to be our own advocates.
Preventing and doing what we can to avoid it, and then getting the right care for ourselves if in fact we are diagnosed. Dr. Catherine Carruthers, from Holy Redeemer, thank you very much. This
Thank
is
you.
Dr. Carruthers and Dr. Stacy Kreischer, also from Holy Redeemer. Thank you so much for your expertise. If you have questions or comments for the doctors, or you want to share your story one more time, I'm going to invite you to email me, lynn@lyndoyle.net. Until the next time, my thanks to my crew and to you for watching. Get a mammogram. Bye-bye.